My father was also a homeopath. He met one of the last remaining pharmacists prescribing homeopathic medicines. And through them, he met Dr. Donald Froebster, a very famous homeopath to the royalty. He took his training from him and then developed his own schooling to teach other homeopaths who went on to create all of the schools in Great Britain. I moved to Nova Scotia where I started my practice and developed quite a large practice. It actually grew and grew and grew. One of my colleagues at the time had taken a course in what she thought was a homeopathic training, and it turned out to be what was being called the homeopathy of bodywork. And this was the practice of Bowen therapy. And in our practice, anyone with an ache or pain or misalignment went to get Bowen therapy first because it just worked. Bowen therapy is a physical therapy. It's a form of body work. There's no question about that. It's not energy work, it's not massage, but it is a hands-on therapy. Most people with chronic disease or an acute problem have a structural aspect to that problem, whether it's the allergy, it's their histamine response that is causing the allergic symptoms. So it's a sort of a reaction, and it's a kind of overreaction that can be attenuated or changed by physical therapy. So what makes my practice unique is that as a practicing homeopath, you're trained to do as little as is possible to motivate the person's vitality to do a better job of healing, of getting better, on its own steam, without support, just with a little push. Homeopathy is the most interesting of medicines. It's very hard for people to understand how something so small could stimulate a reaction in a person that's life-changing, physically, emotionally, and mentally. You know, when you get a cold and you have a fever, and then you have the aches and pains and all of the eliminations that go along with it, the nose and the upsets and so on, what gets you better? Is it the neocitran? Is it the echinacea? Is it the euphrasia homeopathic remedy? None of the above. It's actually your body's own potential to manage its health, to restore homeostasis, prime health. It's all about stimulating a more appropriate reaction to the problem they already have. And homeopathy works by giving a dose of an artificial disease, even a little bit stronger than the one you already have. Why? Because a remedy is made from a substance that if you took a large amount would actually produce the problem that's similar to the one you have. By giving it in a small amount, you're taking the artificial dose of the very same problem you already have. And that artificial dose is re-inoculating your own ability to react. It reinvigorates it, makes it stronger. What motivates me to come to work every day is really to see the happiness that being well brings people. That feedback is what makes me satisfied. To see a happy person because their pain is better, because they're living their life in a more healthy, productive way, is an everyday miracle, every day. In Bowen therapy and homeopathy, I have tools that are curative, not just palliative, to take away symptoms. That's not health. The independent health of an individual is my goal. And that's when people become free, they become happy, And that makes me happy.